the likelihood of their developing card-carrying bipolar 1 disorder is certainly higher than if you don't have a parent with bipolar disorder. The rates are probably about 5, maybe 10% maximum over the lifetime of their disorder. Certainly higher than in the general population, but not as high as their likelihood of developing another condition. So if you have a child with ADHD-like symptoms, they've been pretty chronic, looks like ADHD, and you've got a parent who's got bipolar disorder, the temptation is to think maybe these ADHD symptoms are a manifestation of that bipolar disorder. And you certainly do have to think about that carefully. Unless that child really does phenomenologically have mania or significant depression, I'm still more likely to go with my ADHD treatment simply because you get the answer to that question much more quickly. And at least the data that we have so far does not suggest you're putting that child at risk for further difficulties with manic depression. That's different from antidepressant treatment, where there is some suggestion that you may increase the child's likelihood of developing a manic episode. But for ADHD treatment, I think not treating the ADHD is much more likely to get that child into trouble than speculating about whether, in fact, that's a different form of manic depressive illness. Not everybody will agree with me about that, but that's my thinking on the subject.